1 million children have been administered with malaria prevention drugs in Borno State by the state government in collaboration with the World Health Organization and its partners. There's been a prevalence of malaria in Borno State, especially during the rainy season. Report says malaria causes 50% of deaths in the country. A medical doctor, Obinna Ebirim, joins me now live via Skype to discuss the development. Thank you for joining us, Obinna. Well, Obinna, can you hear me?
Yes, I can hear you. Good afternoon.
Good to have you on the news. It's reported that this prevention drug clears the blood of Plasmodium from contracting malaria. Tell us, how exactly does it work?
Okay, really it gets into the blood and they attack the cycle of the malaria parasite. When it gets injected through, by the mosquito into the blood, it goes through a cycle before it then causes the ailment that we feel. That's the fever and other symptoms. So what the drug does is to attack those components of the cycle to prevent it from getting to a point where it then causes the symptoms. But it's a whole lot of pharmacology around it, which would be so much for the public to feel. What is important is once you see the symptoms, you go to the hospital. As doctors, we know the right drugs to prescribe. If you're allergic to one, we could switch to the other one. And where we have doubts, we then we work in collaboration with pharmacists to inform us on the best anti-malaria to use. But what is important for the general public to know is that it's a drug that attacks the cycle to prevent it from getting to a point where it causes ill health.
Does this mean that once this prevention drug is administered, the recipient can not contract malaria even if beaten by one?
Come again. It seems I missed your first question. Are you talking about a preventive vaccine or are you talking about the anti-malaria drug?
No, I'm talking about the preventive vaccine that was administered to children in Borno State.
For anti-malaria vaccines,
preventive vaccine
for malaria, right?
Exactly.
Yes. So basically, this is different. I was talking about the anti-malaria for vaccines. Okay. What vaccines do to the body is that it prepares the body against the foreign body, so that when the foreign body comes, the body is more empowered to fight, right? So what happens with a vaccine is that when you get a vaccine, it builds up an antigen-antibody reaction, then prepares the body. So the body, when the body is hit by the enemy, which could be a virus, a bacteria, and all that, the body is already prepared and then mounts an adequate, a stronger response to that invading organism.
It's all right, doctor. What then is the role of keeping one's environment clean to avoid the breeding of mosquitoes as against administering prevention drugs? Okay, I'm afraid we lost contact with Dr. Obinna. Dr. Obinna, are you there?
Yes, I'm there. Sorry.
Okay, back. I asked earlier that what's the role of keeping one's environment clean to avoid the breeding of these mosquitoes as against administering preventive drugs?
Basically, keeping your environment clean, getting rid of stagnant water, and these are the basics. These are the best ways of preventing the spread of malaria. And that is what we advise as medical doctors, as public health specialists. We advise the community, we advise families to keep their surroundings clean, to prevent, remove any stagnant water around the house, in addition to using mosquito nets and all that. Because the truth is that if you remove those stagnant waters, you remove the breathing space for mosquito, and when they can't breathe, they then will not be able to mature to a state where they infect humans and then cause the malaria ailment disease. So basically, that is one of the basic ways of preventing malaria. Keep your environment clean, remove all stagnant waters, and ensure that those the environment that supports breeding of mosquito is removed. Why? If you do that, you have less chance of contracting malaria.
Thank you very much for joining us on the news, Dr. Obinna. Thank you for finding time to come.